Hi, my name's Andrea Capere, and you're watching Mission Nonprofit. Each month, we connect with local organizations and agencies that are making a positive impact in our communities. We've invited PCAF to talk about their work today. Thank you for joining us.
Thank you so much for having us. We're happy to be here.
Thank you. So, Eric, how about we start with the history and the mission of PCAF?
Sure. So I'm Eric Seelbeck. I'm the Executive Director of PCAF. The name used to be longer, Pierce County AIDS Foundation, but while we started in Pierce County in Tacoma 32 years ago, we have expanded our coverage area. So we serve Pierce, Thurston, Lewis, and Mason counties now. So we go by PCAF as a shorter name to sort of talk about why we are not just in Pierce County. Mm-hmm. Our mission really is to take care of people living with HIV, prevent the spread of HIV, and fight HIV-related stigma, all under the guise of working to end the epidemic.
Okay. And why is this important work? Not only in the region, but sure. If we could talk a little bit about why is it important to you personally?
Sure. I mean, for me, HIV has impacted my life since I was a kid. I came out into the beginnings of the epidemic as a young queer person, and so it has always been a part of my life. My first friend died when I was 18, and so it's always been impacting my community. It's really important because it's not over. The epidemic isn't over. People are still impacted by HIV. People are still living with HIV, still needing services. So that's sort of my reasoning. Mm-hmm.
Mm-hmm. My name's Dory Neese. I work as a client services team lead in the Olympia office. I'm in this work for a variety of reasons. I'm a social worker. Social justice is really important to me. Working in the community I've lived in for almost 20 years is really important to me. And yeah, I just remember in the early days of the epidemic being really struck by just how impactful it was on people around me and my peers. So, yeah.
My name is Jacob Lucas. I'm a prevention and health coordinator with PCAF. And although as a young queer person, I wasn't alive during the epidemic to see that, I do know the history and I do know how it has affected my community. And along with that, health has always been something that's important to me, especially sexual health. And so that work all kind of brought me into this work.
Mm-hmm. Let's talk about, I'm sorry, did I?
Oh, I was just going to add, I think almost everybody who works at PCAF has some kind of connection. Whether it's direct impact, family, community, all of us are invested in doing the work to end the epidemic. So it's an amazing crew of people, really. Mm-hmm.
That's good to have at work.
Right?
Yeah.
Right?
So let's talk about how PCAF lives its mission as an organization.
Sure. You all want to start?
I mean, in several ways. I mean, so we're serving Pierce, Thurston, Lewis, Mason counties, like Eric said. We have about 610 clients total who are clients living with HIV amongst those counties. And then prevention, the work that Jacob's doing is also a huge part of the mission, and he can share more about that. But we're just doing very intensive case management, and the beauty of it is that we get to meet clients where they're at and sort of start from there and figure out what their priorities are and work with them to connect them to resources and supportive services that would be helpful to them. So I think the mission is that we're able to really support people and also respond to their needs and things like that. I think one example is one of our case managers recently proposed that we provide some kind of funding for clients who are transgender so that they can purchase makeup so that they can feel safe and whole in themselves. And we were able to get the funding to accomplish that and now provide people with a gift card so that they can purchase makeup. So we're a small enough nonprofit that we get to make a lot of our own decisions and be somewhat autonomous in some of the programming and interventions we get to do with clients.
And that freedom allows you to be more impactful to your
I think
community.
so, yeah.
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 Let's talk about the prevention piece.
Yeah, so I think one of the bigger pieces of prevention is definitely testing, just knowing your status and things like that. But when people come in for testing, that is a 20 to 30 minute appointment, and that gives us time to talk about other needs they may have. And even if PCAF isn't able to provide exactly what that need is, we do have a lot of resources around the community. And so if someone indicates they have some type of need, I'm still going to work with them. Even if PCAF can't offer it, still work with them to find out who can. And I think that's one of the big ways that we live our mission.
I would just add that our staff tend to undersell themselves and their innovation and creativity. So Dory talked a little bit about how one of the staff members came up with an idea for a new program, but they do that all the time. So I hear in my office people coming in with ideas about how can we be better responsive to the needs of the folks who are coming through our doors every day, whether it's through the prevention services or figuring out testing services, whether it's through various needs that people identify when they come in at intakes for case management. Our staff are like on point about figuring out how to be responsive. We are seen as innovative and throughout the state, and so people often look to us as models of how do we do this work. When I think about ending the epidemic and taking care of people and living that mission, really is about how do we adapt our programming, how do we adapt the work that we do, our approach to the world, so that it really is what's happening today, and how can we be there in that moment. I think also that I think about the drivers of the epidemic. The reason that this epidemic isn't over is that racism, sexism, homophobia, transphobia are still rampant in this country and the world. And our job as an organization is to do social justice work also. So it's not just about how do we take care of a person when they come through the door or make sure that somebody knows their status. It's about how do we work to address racism, which is harder, deeper work.
Absolutely.
But we have a commitment as an organization to figure out how is it that we are addressing racism within the walls of our organization. So that's like looking at policies, looking at hiring practices, looking at how we exist in the world as an organization from a social justice standpoint, so that we can then do the work addressing structural racism and homophobia as drivers of the epidemic. We're really shifting in the last couple of years to thinking more about what does the end of the epidemic look like. We have newer tools available, and I think they might talk about PrEP and U equals U. I'll just tease that and let them talk about it. But those newer tools that we have mean that we could actually end this epidemic. And that's not something that we had 10 years ago, 15 years ago when I was coming out. So there's hope now that is different than it was before. If we have the resources and if we can do some of the other work around structural racism and homophobia and sexism and transphobia in order to really get to the end. So from my perspective, like, I can see the end if we can actually do the work that could get us there.
And so stigma and these isms, they persist because of fear and a lack of education.
For
so
sure.
Can we talk a little bit about the educational aspect and what are you doing to reduce stigma?
Sure.
I mean, I think that's a pretty big topic, but I think the work for me in the client services department starts with the clients themselves in terms of there's a lot of maybe internal stigma, or our clients are kind of experiencing that marginalization pretty constantly when interacting with providers, interacting with benefit systems. So I'm kind of micro-focused on that in terms of the clients themselves. But one of the things that is really exciting is that I think it was a year or two, or maybe just a year ago, the Center for Disease Control actually is officially backing the science around what we call U equals U, which is undetectable equals untransmittable. So out of the 613 clients that we serve, 82% of them are virally suppressed, meaning they have an undetectable viral load. And that is amazing. That's a pretty good percentage. And that's not an easy task. Like, that means these, our clients, these 613 people are taking their meds every day, seeing their providers frequently, getting labs done, and all the while navigating multiple barriers that are coming up in their lives. So the impact that has on the internal stigma and the fear around transmission is kind of a game changer, in terms of people feeling like they can be who they are and exploring their sexual health and their interest in that. So
The whole person.
yeah.
What about you, Jacob?
I think that fear and stigma definitely play a huge role in prevention because they definitely play a huge role in testing. So whether it be fear of actually going in and getting tested, or the stigma that they think that I don't need to get tested for HIV because this doesn't affect me. As far as education goes, anytime that someone walks in the door, anytime that someone is there for testing services or any type of prevention services, there's going to be an education piece. There's oftentimes a lot of misinformation. There's a lot of, if there's not questions, there's a lot of things that come up that you can tell that they're not 100% sure. And so there is that educational piece, whether it be during testing or during like navigation services for PrEP that we were talking about earlier. There's always going to be some type of education about transmission, about stigma, and about different pieces of misinformation that they might have been fed before.
I think part of our role as an organization is to remind folks that HIV is still around, that it's not over. One of the things that I frequently hear as I'm out and about is, oh, you're still here, right? You as an organization are still around. We don't hear about it, right? So the media coverage just isn't there in the way it was in the early epidemic. It's just sort of faded from the public consciousness, if you will. And so our job is to just keep reminding folks it's here, it's here. Down here in Olympia, I frequently hear, well, what's happening? Because we didn't know you were here doing work, and we're building on the legacy of UCAN, which was here for about 25 years through 2012. And in 2012, they came to us and said, "We can't sustain as an organization. Will you take over our contract so that the people we serve can continue being served?" So we've been serving Thurston County specifically since 2012, but we're still getting those questions of, well, where's UCAN? Who are you? Why is PCAF here? Wait, PCAF is here? There's still HIV, kind of thing. And so our job, as we're making our way through the world, as we're doing the prevention program and working with clients and public facing, is to really remind folks that it's not over. We're still here. We're still around.
And I can echo that, because as we were talking about this, I realized your use of the word epidemic. And 15 years ago, I felt that it was, and it still is, clearly. So what do you think is driving that lack of consciousness?
Well, I would start with people aren't dying as frequently or as often. So
accessing medical care.
Right. So the early days of the epidemic, there were the visibility was pretty high in both in terms of media stories, in terms of activism. So ACT UP was really engaged across the country and the world. And people were visibly sick and dying in a different way. And so as the medications have developed, as people are living longer and healthier, the sort of visible nature of it has faded. So you can't really tell who's HIV positive. And I think that sort of has fed into that also, and the fact that the death rate has slowed way down because people are living longer and healthier, and those meds are doing incredible work, right? And it's hard to sustain a sense of urgency over time, right? So the urgency of the early epidemic was huge, because people were just dropping like flies. And to sustain that level of engagement broadly is hard, because the public attention span I don't know if I need to say more than that,
Yeah,
right?
yeah.
It just quickly moves on to whatever the next big thing is, as we can see in the media these days. And so we're an old story, even though it's still this constant epidemic.
Yeah. And so let's talk a little bit about the PrEP piece, because that's a significant change in
Yes.
the landscape.
Game changer.
Yeah,
Jacob?
so PrEP is a relatively new intervention that we have for HIV. It's been FDA approved for about 7 years now, and it basically entails that you take a pill once a day, every day, and it's over 90% effective against preventing HIV. And so a big thing that we do in the prevention department at PCAF is what we call PrEP navigation. And so we know that healthcare systems are not the easiest to navigate, and luckily our prevention team is really skilled and really experienced in navigating these things. So whether it be finding a doctor that you feel comfortable with, or getting you onto insurance, or finding financial sources to help cover the cost of this medication, to help cover the cost of your doctor visits, everyone in the prevention department is really good at finding out what you need and finding out where to get the things that you need. And so, yeah, PrEP is definitely going to be a game changer in ending this epidemic.
Yeah, so it's two pieces. It's the prevention and knowing your status. So let's talk about that. Some of the folks that might be watching might never have been tested, and that fear is what keeps them from walking in the door. So can we talk a little bit about what a client might expect when they walk in the door?
Sure.
Yeah, so they walk in, we have a really simple form. It's one page, fill it out. You'll come back with me, and we'll kind of talk about your sexual health, talk about your potential risk behaviors, and then the test is really, really quick. It takes 20 minutes. It's just a little finger prick, tiny amount of blood, and then that 20 minutes gives us time to kind of go deeper into the conversation, talk a little bit more about HIV, talk about transmission, and kind of demystify any questions that they might have. But it's a really simple test, and you get your results the same day. So it's a very, very simple process.
Very different from the early days of testing, where you go in and you have to wait a week or two to get your results, and the anxiety in that time is huge. Right now, you go in 30 minutes later, you've connected with our prevention staff, and you know your result. And the importance is, if you're negative, then you can talk about behaviors that may be less risky, or protective behaviors. If you're positive, then we can connect you into care services, have our case managers connect you. One of the things that Jacob said was that the prevention staff are really good at finding resources and connecting people, and that's true of the case management client services staff too. Like, they are mad skilled at navigating systems and finding resources for people. I'm always amazed at how much they know about what's available out there. And that's part of the thing is, we're not just looking at HIV, we're looking at the whole person, right? So people don't come in just with an HIV diagnosis or wanting a test. The rest of their lives are impacting it also. And so the work that they do around looking at what is it that people need and how can we help them get it is really critical.
And so how often should someone be tested?
Kind of depends. If you're sexually active, once a year, and then depending on how many partners you have, things like that, more often. But I'd say once a year is a really, really standard. Every 6 months is pretty standard.
Okay. And so we've talked about some of the fantastic programs that you offer. Can you tell us a little more about some other services and programs available at PCAF?
You want to talk about the wraparounds?
Yeah, so in the client services realm, we have a really robust housing program. We have an excellent food and sort of nutritional support program in both our Tacoma and Olympia offices. We provide medical transportation resources, so we'll assist clients with a gas card or bus tickets to be able to access different benefits or access to medical care, other kinds of resources that they're needing. Of just a ton of different things that we're doing in that department. And I think that when we were talking about this community, this specific Thurston County community, sort of going, you guys are here. The thing is that we are actually connected to a ton of community partners, and have been since 2012 when PCAF sort of took over. We partner every year with the Thurston County Food Bank to give out about 80 turkeys and, boxes of all the fixins for that holiday. We partner with Pizza Clatch, the Olympia Timberland Library, made a brochure just for us about resources for clients that might be helpful or non-clients, families. Who else? We partner with Stonewall, just kind of the whole, we're constantly calling Sidewalk or the Family Support Center. So we're very connected to this community, even though maybe the greater community is still like, huh? But you're called Pierce County, so
Right.
yeah.
We struggle with that too, with our name change. Media versus television, county
Right.
versus community.
Right.
Yeah. So let's talk about those that you serve. I think that there might be a sense of who might walk through the door, but anyone is at risk for HIV. So who are you trying to engage? Who are you welcoming into the door?
So I'd say on the surface, our goal is to reach communities who are disproportionately impacted by HIV, but our doors are open to anybody because we know that the virus doesn't discriminate. So I think it's important to acknowledge that there are communities who are disproportionately impacted by HIV, communities of color, LGBT communities, and that anybody can become infected. And so you can talk a little bit about sort of the range of folks you see in your programs.
I mean, we serve men, women, youth, a variety of sexual orientations and experiences, injection drug users. Our demographic is aging. We work with a lot of long-term survivors who really did not expect to still be thriving or living today. So like you said, it doesn't discriminate and our doors are open. If you have a HIV diagnosis, we will be able to provide some kind of service for you or link you to care or medicine or things like that.
I want to talk about, with just a few minutes left, I was struck with the word of hope. And so I want to talk about what makes you hopeful. What are you looking forward to going forward?
I always start with the staff at PCAF make me hopeful, just because they're so incredible and dedicated, creative, innovative, hardworking. And so as I sort of look out at the work that's being done and see how engaged they are, that gives me hope on that level. And also, the changes where we have U equals U and PrEP, those tools that are game changers. There's research being done on a cure, and when I was a teenager coming out, we weren't allowed to think about cure at all. And I've met Timothy Ray Brown, who is the first person who was cured of HIV.
And now there's a second one.
And
right?
now there's a second,
Yeah.
we think. But the methodology is terrible, like bone marrow transplants, right? And so that they're not replicable. But I got to drive him around in my car and be like, this man sitting next to me has been cured of HIV, and that was not something that I've ever been allowed to believe in. And so, as a queer person whose community is impacted by this disease, and I'm working in it, those kind of things really make me hopeful that we can get to an end.
I feel very hopeful about how many clients are undetectable and engaged in care and just taking care of themselves, and also that we're doing a lot of work to increase efficacy of the communities we serve. So we have a client advisory board, we have clients now facilitating groups and participating in long-term survivor events, and just kind of giving more voice to the actual communities that are impacted.
I think when you look at the history of the virus, in 30, 40 years, we've made advancements that aren't really replicable to any other condition, disease, infection, anything. When you look, 30, 40 years ago, how different it is from today. And when we talk about things like PrEP, when we talk about things like U equals U, there is a chance. There is, ending this epidemic is very possible. And I think that's what keeps me and a lot of people at PCAF hopeful for the work that we do.
Mm-hmm. And so how can the community continue to support this work?
Sure. Well, I think being aware that it's still around, educating each other and themselves about HIV and sort of knowing what's happening, paying attention to the organization and sort of seeing what kinds of events we have.
Check out our website.
PCAF.org?
PCAF-WA.org.
Yeah. Lots of information on there about testing, resources, and events that we're doing. And I think just if people have any concerns, they can just call us and we'll answer any questions. Yeah.
We're always looking for volunteers. We're always looking for donors. But there's lots of different ways that people can engage. I think connecting and starting with the website is a really good place to do that. I don't know if you wanted to add anything.
Great.
Come get tested with
Get
Jacob.
tested.
Right. Know your status if you don't.
You can get condoms, lube. We have female condoms.
Dental dams.
Yeah. And we usually have candy at our front desk.
Right. I think, having conversations with your friends, family, community, and being like, hey, do you know your status? If you don't, go get tested. If you know somebody who's HIV positive, just checking in with them. Are they in care? Do they have medical
Normalize
provider?
it.
Yeah.
Yeah, just be like, it is part of the conversation. It's not a scary topic. It doesn't have to be a scary topic.
Yeah. Well, I want to thank you all for coming on.
Yeah,
and
thanks for
speaking
having
with
us.
today. Thank you. That's all we have for you. You can see Mission Nonprofit on Channel 77 on Sundays at 4:30 p.m., Tuesdays at 7 p.m., Thursdays at 7:30 p.m., and Saturdays at 6:30 p.m. You can also catch us online at tcmedia.org. See you next time.